Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about some body changes you may notice after pregnancy. Motherhood changes you in many ways. Many changes are physical, such as changes in your clothing size, breast shape, hip width, and even your shoe size. Other changes are emotional. Let's look first at some of the physical changes you may experience after baby is born. Your sense of smell may have been acute during pregnancy. This usually begins to fade 6 to 8 weeks after baby's birth. If your gums bled more easily during pregnancy, they should get better now. Keep flossing and brushing regularly. You may want to schedule a dental cleaning and an exam a few months after baby is born. Swelling in your legs, hands, or feet lessens or disappears within a few weeks. You may find you perspire a lot, especially at night. It's caused by changing hormones and your body's attempt to get rid of extra fluid. Skin may also change after pregnancy. It may feel drier than usual, or you may experience acne, itching, oily skin, or hives. Varicose veins may lessen and eventually disappear, but spider veins may be permanent. If your fingernails and toenails grew rapidly during pregnancy, growth usually returns to normal in a couple of weeks. Nails may even become brittle after baby's birth. Hormones during pregnancy can stimulate hair growth, and your hair may have been thick and healthy. After delivery, you may notice hair loss. You are not going bald. Hair growth will return to its normal growth pattern within a few months after delivery and should be normal within the first year. After birth, your body gets rid of the blood and tissue that was inside your uterus. This vaginal discharge is called lochia. In the beginning, it's usually heavy and may contain blood clots. As time passes, the flow becomes lighter in color and amount. It can last up to a month or more. Don't use tampons. Use sanitary pads until the discharge stops. Wait at least 6 weeks postpartum before using a tampon, or you risk infection. If you feel pain or burning when you urinate in the first week or so after birth, it's normal. If you try to go to the bathroom and can't, or if you dribble some urine at other times, it's called incontinence. It usually goes away as pelvic muscles strengthen. You may have stretch marks on your tummy, breasts, thighs, and hips. They won't disappear after baby birth, but they do fade over time. You can use creams and lotions, but let me tell you, there are no magic potions to make them go away completely, no matter what you hear. Your hips may return to their pre-pregnancy size and shape as ligaments and joints tighten, but some women find changes are permanent. It can take 6 months to a year to get back to your pre-pregnancy weight. If a woman gained 35 pounds or more during pregnancy, it can take up to 2 years to return to a normal weight. Other changes you may experience are emotional and caused by changing hormones, which usually return to normal 3 to 6 months after baby's birth. Your level of oxytocin increases at birth, which helps your uterus contract and prevents excessive bleeding. Oxytocin is also linked to bonding with baby. Prolactin, necessary for lactation and breastfeeding, also increases. As estrogen and progesterone decrease, you may experience baby blues. And when you wean baby from breastfeeding, Various hormone levels drop, which may make you feel sad, anxious, or irritable. If you experience changes after birth that seem beyond normal, contact your doctor. He or she can reassure you a situation is typical. If it isn't, and it needs to be addressed, your doctor wants to know about it and may want you to come in for an appointment. Don't worry or fret if you go through many of these changes, either physical or emotional. It's all part of the process of becoming a mom. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be.